Dr. Michael Ryan with Missouri Vein Care answering a question that we get probably every day of the week, which is there an alternative for patients to the standard compression stockings that are available? Compression stockings are very effective at helping with leg symptoms when someone has a vein condition. And they do have a special quality which is called graduated compression, which means the amount of pressure is higher at the ankle than at the knee and at the thigh, which mimics the effect of the increasing pressure as the blood pools in your leg from gravity. So the gravity pressure is going to be much higher at the ankle than at the knee or at the upper thigh. So graduated compression stockings have a really good track record for helping with that pain associated with a vein condition, but they're very difficult for many people to put on. We do have some tips in our some of our videos that can help with that. But people want to know, gee, I can't really get them on. What else can I try? And there are a couple other options. One is something called Tubigrips. They are not graduated, but they do also provide very comfortable compression. And patients that wear them uniformly say, "Gosh, that feels so good on my legs." And it's because I think they breathe better than other types of compression, and they're less constraining. You can also take two Tubigrips and put one over the other to get an extra amount of compression if you find that that initial layer is not strong enough. That's another trick that we've used, and patients are very satisfied with that. And the second layer is easier to put on than the first layer because it's sliding over the Tubigrip. So for people who have arthritis in their hands or weak hands, that is really helpful. Another class of compression is called Circaid, and that is a very nice design, which is basically a Velcro style compression where you wrap it around your leg and you tug on it. It has a kind of a guide. A rectangular area will expand, and when you get to the right size, that's the correct amount of compression. And so it's easy to titrate the compression to your leg, and it's easy to take it off and put it on. And so you can take it off and put it on in just seconds, and patients really like that. It's especially helpful if you have an open sore, and some patients with vein conditions develop open sores because that allows wound care to go on, and you don't have to struggle with putting a compression stocking over a dressing. The final recommendation I have for patients is to use lighter weight compression stockings, and they have different grades of compression. There's 5 to 15 millimeter compression. There's 16 to 20 millimeter compression. There's 20 to 30, and it keeps going up higher. The lower weight, 5 to 15 and 16 to 20, are generally considered light and aren't often recommended by practitioners. But I found that for some patients, they're able to get those stockings on successfully. It provides enough relief for them. And also, if they want to double up those lightweight compression stockings, they can do that. And it's a lot easier to put on the second stocking over the first one because it slides on. And so those patients really do get some relief. And for some patients who have a lot of discomfort and associated with swelling, and they have a vein condition, and their main problem is that they're sleeping in a recliner at night. They can't sleep flat because they have a breathing problem or they have a back problem. Then wearing some kind of compression like a Tubigrip at night is really helpful for them. So this is Dr. Mike Ryan talking about other options besides standard graduated compression stockings.